It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join News Director Paul David and News Editor Philip Catafamo as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics in Yavapai County that affect all our lives. And now here's today's Countywide.
Welcome to Countywide. I'm Paul David. As always, it is great to have you in studio with us today. Sitting down with me on the phone is Yavapai County Community Health Service Director Leslie Horton, which we've had on every week or every other week since COVID-19 kind of came into our world and shut things down. So, Leslie, welcome back.
Thank you.
The website, yavapai.us, you go there, you can find links to all kinds of different information from across the state. So the yavapai.us is the website we'll stick with mostly. For businesses that are getting ready to reopen, which is happening just around the corner now, and some are open now, yavapai.us/CHS is a good resource to go to in things you may need for your business in order to open up properly and safely for not only you and your employees, but the people coming into your stores as well. And Leslie and I will talk a little bit more about that as we get into today's show. First question for you. The last couple of weeks, Leslie, the governor's talked about numbers flattening out, and he's got some really nice graphs that he shows where this is the hospital capacity. This is what's beds available. These are the beds that are being taken up by patients now that are in there for elective surgeries and other reasons. And then down at the bottom, there's this little like 10 to 12% of beds across the state that are COVID-19 being used. There was talk that we have 1,600 ventilators now. That number may have gone up since last week. And that the PPE is back into the state very well, and that we've got the hospital room. But the one thing I've noticed is that we talk about the numbers have flattened out. The cases, the confirmed cases of COVID-19 have flattened out over the last couple of weeks. But now we've seen kind of a bit of a spike over the last several days in Yavapai County is what I've noticed. Can you address some of that?
Yeah, I'd be happy to. And we did. We had a rather flattening of our curve for a long time. We actually had nearly a month of seeing 0 to 1 to 2 cases a day, and we were feeling really good about it. Like we had done everything that we should be doing, and that our numbers were staying low. And then I'll explain a couple of circumstances that have actually caused a great spike in our numbers. And so our numbers over the course of the weekend, we were at about 89 cases, and by yesterday, we were at 139 cases. And so in one day, we saw about a 40% spike in those numbers. And there's a few reasons for that. And I'll explain also those risk factors for the community in terms of why this may not be as bad as it seems in terms of the numbers. And so we do have some isolated incidences of cases that we're investigating thoroughly, making sure we're doing a lot of testing. And those are currently one of the situations is in our county jail. And we did have someone who was a counselor in the jail who went into the facility for only a few hours, but then proceeded to, after they left, they became ill, went to the hospital, and they actually ended up sadly passing away from COVID or COVID-related issues. And so with that, we've been doing an investigation. Yavapai County Sheriff's Department has been doing an amazing job in tracking this, making sure that their staff get tested, that inmates are looked after and well cared for and tested if needed. And there has been 6 total additional people who have tested positive in our Yavapai County Sheriff's Department. And so that's been unfortunate, but I'm very proud of how the Sheriff's Office has handled that case. That situation, and they seem to have it pretty well under control at this point in time, and we'll hope for the best. And the other situation, though, is Mingus Mountain Academy has seen, they had 2 of their girls at the alternative school for high-risk or at-risk girls, and they had 2 girls that came down with some symptoms last week, went to the emergency department, got tested, and were positive for COVID-19. We proceeded to go ahead and work with YRMC to test 60 of the girls at the school, and of those 60, 40 of them have come back as positive COVID-19 tests. So thankfully in that population, the girls are doing rather well. They're low risk for complications, and generally youth have lower symptoms, are less symptomatic than adults with COVID. And so the girls seem to be doing okay, but the YRMC staff are up there today doing more testing, which may in turn produce more test results and positive tests and higher numbers. But thankfully, at least in that circumstance, the girls are on campus only. They're not intermingling in the community. We are more concerned about the staff if they're testing positive, so we're making sure that they also get tested and doing contact tracing, investigating those cases, making sure that we are following up with family members and friends who may have been in contact with anyone who tests positive.
Let me ask you this, and I don't know that we've really talked about this doing the shows with you on this one. I'm pretty sure it's been talked about, and I think people are aware of it, but some people may not be. And that is, if I'm feeling sick, and it's always been this way, even with flu season. If I feel sick, I'm asked to stay home. If you got the flu, stay home. You don't go to work and spread it to everybody else around work. Now, if I'm not feeling well, and this is COVID-19, and it probably applies to the flu as well, but I think with the flu, we're all that's the flu. It's a cold, it's allergies. But with COVID-19, if I'm feeling ill and I'm at home and I've got 3 kids and a wife and all that in my home, and if I'm not feeling well and I'm going to be taking part in the COVID-19 testing, and I think I may have this, the odds that my family members are going to have it too. So it's not just about me quarantining, it's the whole household that should quarantine. It shouldn't be that I'm feeling sick and I can't be tested until tomorrow, and then maybe my wife or the kids all go to the grocery store and do the shopping and come home. Odds are they may have taken that with them and spread it all over the store. So that's that contact tracing that we're doing, which has got to be I don't even know how we managed to be able to do something like that. But we need to encourage, I think, people that are sick, for whatever reason it may be, to stay home and not spread this. Yeah,
you're absolutely right. And you hit the nail on the head with that one. If we have somebody in the household who has seen symptoms, what they think might be COVID-19, if they're experiencing, even if it's headache, cough, fever, these things that are aligning with COVID-19 symptoms, we do ask that the whole family stay home. Unless somebody's at the point of needing hospitalization, we want them to stay home. We reach out to their healthcare provider, and right now there's actually options for drive-through testing. So let's say a family thinks they might have this. They can actually call their provider and find out if they can go to one of the drive-through testing sites. YRMC and Spectrum have been participating in the testing blitz, which is on Saturdays, and YRMC and Spectrum both allow people to stay in their car while they're getting tested. And yet, with that, like you mentioned, the contact tracing, once we know that a family or a person, an individual, is positive for COVID, we also go and find out who they've been around, whether it's household members, family, friends, or where they frequent. And then we do some investigation to find out who else might need to get tested quickly to find out if there has been any community spread, making sure that we limit the ability of COVID-19 to really take hold in our community. And so our staff, our team of nurses, and our epidemiologists have been working really hard to make sure, especially in situations like at Mingus, where they have staff that go home at night, we make sure that we're doing that contact investigation quickly and get others tested who might need to.
It'd be pretty easy for one person to take this out and spread it in numerous different places if you're out for the day, just going into different businesses and touching all kinds of things. Again, I think we should probably also reiterate before we take our first break here is that I could be feeling completely 100% fine, but as I touch things and move around and breathing on things, I am possibly spreading COVID-19. It's not one of those things where I have to be coughing and it comes out. I think we found out that even just somebody breathing can pass COVID-19.
That is true, and we're asking people to really understand, even as the community starts to reopen, is that COVID-19 is here. It doesn't have a cure. There is no vaccination at this point, and people need to interact in a way that is accommodating for the fact that COVID-19 is here. It can be spread while you have no symptoms, and so people need to interact in a way that pretends or assumes that they have it. And so things like washing hands, mask wearing, that physical distancing is very important as we move forward into more freedoms and going back to work and having businesses open and those kind of things.
All right, let's take our first break. A website for you, yavapai.us. Also, if you're getting your business ready for reopening or you have reopened and you want to go through a checklist, they have one at yavapai.us/CHS. We'll talk more about that with Yavapai County Community Health Services Director Leslie Horton when we come back from a quick break.
Solid Rock Fitness is a one-on-one fitness studio specializing in fitness over 50. I train older adults of all fitness levels, from athletes and avid sports participants to folks with chronic pain to those recovering from surgeries. You and I will focus on strength training to improve overall muscle tone, core conditioning, balance, agility, flexibility, and nutrition. Mastery of these components of fitness will help you live your life to the fullest with confidence and competence.
Paul Stanley here with Stanley Steel Structures. We offer shade structures that provide style, value, and performance. Our Equinox louvered roof opens and closes to give you the ultimate patio experience. We also offer Alumawood shade covers that looks like wood but lasts like steel and never needs painting or maintenance. Visit us at StanleySteelStructures.com. Contact us today and be covered tomorrow. Stanley Steel Structures. Let us add some space to your place.
The EPA says C&B Construction ranks in the top 1% nationally. C&B Construction invites you to see what energy efficiency and indoor air quality can be. We have won another Department of Energy Innovation Award, and C&B Construction is the only contractor in the country to win 6 consecutive EPA Indoor Air Plus awards. Experience our zero-energy, move-in ready homes at Crossroads at Mingus.
C&B Construction, locally respected, nationally recognized. Find out more at C&B Homes.com.
This is Bruce Morrow, Transportation Manager for Cottonwood Area Transit. Remember, we cover the entire Verde Valley and Sedona. Cottonwood Area Transit has you covered wherever you want to ride in the Verde Valley, all day, every day. Take Cottonwood Area Transit through Clarkdale, Verde Village, and from 26 locations in Cottonwood. With Verde Links, it's a quick and easy trip to Sedona every day. Don't forget our connectors to Camp Verde. Visit cottonwoodaz.gov for Cottonwood Area Transit and take a seat. Let's go ride.
Welcome back to Countywide. I'm Paul David, Yavapai County Community Health Services Director Leslie Horton on the phone with me for our Countywide today. Yavapai.us, again, is that website, and Yavapai.us/CHS will help business owners working on getting their businesses ready to be reopened. Some of the check things you want to do depending on what kind of business you actually operate. Let's talk about the blitz testing. That is got to be a reason why we're seeing numbers increase over this last week as well. And I've got to imagine, since we've got 2 more weekends of the blitz testing on Saturdays, that we're probably going to see these numbers continue to increase.
Yeah, you're right about that. The blitz testing has been a great opportunity, though, for our community to go and get tested. And with the blitz, the Arizona Department of Health Services rolled this idea to allow testing for anyone. They hope that it would be free. And we can bill insurance if people have it. They could bring their insurance card. But it loosens up those parameters on who can be tested. It used to be that you had to have contact with a known positive person, and you had to either have symptoms or other reasons to get tested. With the blitz testing, on Saturday between Spectrum Healthcare and the YRMC, they've tested somewhere between 650 and 680 individuals who were able to, either with Spectrum, you can make an appointment, set up a time to come in, or both are taking walk-ins. YRMC set up a drive-through site in Prescott Valley, and people can just drive on through, and they're getting people through in about 3 to 5 minutes per car. There was a little bottleneck in the beginning, but later in the day, I think they start about 8 a.m., both all the sites. And midday, they both had plenty of availability. And so with those, we will see some higher numbers possibly, but really what we're seeing in the general community of those who are getting tested is that our positive test rates, only about 1 to 2% of those that come through actually have COVID. So that's great for our community. I mentioned earlier some of those hot spots or isolated incidences where we aren't seeing a lot of community spread out of those situations, even though they're producing high numbers of cases. We have this blitz testing that's showing us that it's still a very low rate of positive among the general population.
Okay, so I would qualify if I wanted to go down. I feel fine. I don't cough. I don't have any hot flashes or feverish or headaches or any of those things. But because it was before I had to be pretty ill, get a note from my doctor, and then I could go be tested. But that's not the case anymore. For the blitz testing, it's for anybody. The thing about that test is that I could come and get that test there and have it done, but then an hour later I could go to a store or go someplace and touch something and pick it up, and then I could have it like an hour after I have a negative test come in and then be positive for it an hour later.
That is correct. And so a COVID-19 test is a point-in-time test. And so you may be negative at this very second, but go into the grocery store and have someone, cough near you or touch your face after you've touched something that is infected, and you could get COVID-19. And so some people may need to be tested more regularly if they have regular interaction with others who might be high risk, like our first responders, our healthcare providers. They're actually getting tested more regularly because of higher ability to and more contact with those who could be infected. And so we do recommend, though, that people get that baseline test. Like we want to know, we know that the more that we know about the situation of COVID in our community, the better that we can mitigate the spread and keep it from spreading to others. And so we do encourage people, especially if they're going to be reentering the workplace and being in the community more, that they go get tested. It's free. It's pretty quick, and we get the test results back within about 2 to 3 days after that test is taken.
Okay, so the test, I'm really interested, and I can see where that would be a benefit to people who are opening their businesses up because they know that all their employees are good to go to start off with, at least there. I want the antibody test. I want to know, did I have it or have I not had COVID-19 yet? And I feel like that's the test we really need to get and just spread everywhere, because I know we're trying to track down, okay, where are the hot spots in Arizona? Where do we have a lot of COVID-19 cases spreading around so we can kind of isolate those areas, let the rest of the world kind of get back to work and back to life, and then handle it, and then hopefully keep it from rearing its head again through the summer and fall months.
Yeah, and the theory with antibodies is that once you have experienced the virus and your body produces antibodies, you have some level of immunity to it going forward. We don't know how long that immunity lasts, but sometimes it's many, many years. And so we're hoping with COVID-19 that once people have experienced it and their body is producing antibodies against it, that they will have less chance of ever getting it again. And so that does produce, if we have more and more people in the community that have antibodies, that produces that herd immunity where people are less likely to get it. We're better able to protect those that are vulnerable to this. And so, we are encouraging sites, all of our healthcare providers, to take on antibody testing. And it does take a blood draw. So with the COVID-19 test, a lot of times it's a nasal swab. With the serology antibody test, it is a quick blood prick or sometimes a blood draw that'll fill a little vial, and yet they can then see if you've ever had COVID. A lot of people thought that they maybe had it in January, February, before it was ever being tested for here. So it would be great if we knew that we had some level of herd immunity here for COVID-19.
Okay, so it's really up to us to go out and get that blood test then.
Yeah, it's important to go talk to your provider and see if they have it. I know several agencies here locally are rolling out the serology-type antibody testing. Some of them are doing more rapid antibody testing, and there is a wide range of accuracy in the tests, and we're still kind of finding out which ones are more accurate. We do know the serology one with the blood draw is probably the most accurate that you can do.
Okay. All right. Real quick, we're going to take another break. Before we do, though, There's the blitz testing is again taking place this coming Saturday. Spectrum at 651 Mingus Avenue in Cottonwood and in Prescott at 990 Willow Creek Road. Both locations from 8 to 4 p.m. I think 8 a.m. to 4 p.m. I'm sorry. And you can go to SpectrumHealthcareGroup.com to set up an appointment to do that. And Yavapai Regional Medical Center in Prescott Valley will have shortened hours this weekend from 9 to noon, and they are at the Del E. Webb Outpatient Center at 3262 North Windsong Drive in Prescott Valley. So that's where the testing is going to be taking place. Again, if your business is opening up, yavapai.us/CHS is a good site to go to for information about how to safely open your business, protect yourself, your employees, and your customers. And then yavapai.us is always a good site to go to as well. This is Countywide. We'll take a quick 2-minute break, and we'll be right back.
Do you need more closet space? Hi, I'm Tracy Shadley, owner of Organize A to Z. We provide professional custom design solutions to keep you and your space organized, which helps reduce your stress, increase your productivity, and allows you to take control of your belongings. We are proud to be locally owned and operated, specializing in custom closets, garages, offices, and pantries. Call me today for your free consultation. Organize your space, organize your life.
Two things we can count on every year:
a new set of tax rules and great weather here in northern Arizona.
Jackson Hewitt Tax Service, locally owned and operated by Lewis Rice since 1997, is here for you all year long.
Your neighborhood Jackson Hewitt Tax Office will help you in all of your taxing situations.
Electronic filing is always free with your tax preparation at Jackson Hewitt Tax Service.
Get more in return. Call 1-800-234-1040 for an office near you.
With too many senior homeowners falling short in their retirement dreams, there may be great news for you. A reverse mortgage may be the answer. The flexibility it provides may help you with your retirement dreams, peace of mind, and quality of life in your retirement. For your in-home, no-obligation consultation, contact me at 928-225-7418. That's 928-225-7418. Or you can find me at Facebook at Jim Hostler, Reverse Mortgage Specialist.
Hi, this is Lori and Melissa from Sedona Soul Spaces. We are the premier source for all your interior design, decorating, and staging needs.
Every day people ask, why didn't I call you sooner?
Let us use our passion, creativity, and experience to make your life easier.
Don't make costly mistakes. Call us and we will help save you time and money.
We offer full-service interior design, custom furnishings,
complete home staging, turnkey vacation home packages.
Sedona Soul Spaces, creating extraordinary spaces that delight your soul.
Welcome back to Countywide. Just a few minutes left of the program. Again, website, yavapai.us for businesses, yavapai.us/CHS. Leslie, let's talk a little bit about that. Businesses are reopening, so what can they do?
Yeah, it's important that businesses keep in mind that COVID-19 is going to be here in our community, and they play a very important part in helping us to keep it from spreading. And we want to make sure that businesses are comfortable in reopening. I know that a lot of them are very ready to do so. But as they go forward, we're putting out guidance on our website. You've mentioned the website a few times, yavapai.us/CHS. We have a little link there for COVID-19 resources for reopening. And a lot of the guidance that we're giving to businesses surrounds the ideas of physical distancing still, wearing masks if need be, washing hands often, washing commonly used surfaces often, and really keeping in mind that we are going to see COVID-19 pop up here and there, but the better they can do to show the public that they're doing their best to protect their customers, their staff, everyone they interact with, the more people are going to feel comfortable about shopping again and getting out and utilizing the restaurants and the businesses and the salons. And so making sure the businesses do their part and show the public how they're doing that is very important moving forward.
Is COVID-19 going anywhere? Coronavirus, it seems like it's going to be like the flu. It's just going to be part of our lives, and we're going to have to find a way to deal with it.
I think you're right. I think that, at least for now, we don't have a cure. We don't have a vaccine. And it's not seemingly going away with hotter temperatures as sometimes the flu does. And so we really do need to just keep in mind that there are some practices that we need to make habit in our communities that'll help to protect those who are at risk for complications of COVID, and making sure that we can go back to business and get our economy running again. But at the same time, people are going to also have to use better personal responsibility. And if they consider themselves high risk, they're going to need to really interact in a little bit more careful way for a while in order to keep and protect themselves from COVID-19.
All right. We'll probably be doing this again, I would imagine, Leslie.
Yeah, I think we'll probably talk again about this, and I appreciate that the public is interested, and I know that they're going to do their best to make sure that we're keeping these rules in place even as things start to open, as tourists start to come our way. We'll do our best as a community. I'm proud of how we're doing so far.
Okay, websites again, yavapai.us or yavapai.us/CHS. Yavapai County Community Health Service Director Leslie Horton was with me today on today's Countywide. As always, we thank you for watching and listening. We'll talk to you again next time.